For more than 40 years, staff at the Brent Centre in London have been providing expert help to young people struggling with mental health problems. It's a good example of joined-up services, working with local schools to provide early help and support before things can spiral out of control. And for some young patients, the Brent Centre has been a real lifeline.
You leave with a feeling of accomplishment, satisfaction, confidence. I've gained a lot of confidence. I feel like I can understand what I'm doing and what I'm feeling, and yeah, it's something really positive.
But today's report into mental health services for children and young people in England describes a system struggling to cope. It says the safety of children and young people is being compromised. It describes as wholly unacceptable the practice of detaining children and teenagers in police cells, and it says families face long delays and have to battle to get access to community services.
That's a very clear recommendation that we need more funding in children and adolescent mental health services, and we need to be very clear about, at the moment, we need to not only have extra beds, and that is being funded, but crucially we need that investment to go into those prevention and early intervention services.
And those who work with young patients say the report reflects their everyday experience.
Services are overwhelmed. Many can only offer treatment to the most difficult and complex cases, and often services can only offer brief interventions and are forced to discharge people prematurely.
The Department of Health in England says steps have been taken to improve services, but there has been an acknowledgement in recent months that mental health is often the poor relation in the NHS. This report makes clear that has very real consequences for some of society's most vulnerable. Dominic Hughes, BBC News.